Imagine waking up one day to find that your health insurance premiums have skyrocketed by as much as 75%. For millions of Americans, this isn't just a hypothetical scenario, it's a looming reality. And it all stems from decisions being made right now in Washington, D.C., where partisan politics could reshape the future of healthcare accessibility and affordability. But here's where it gets controversial. While some lawmakers are pushing for policies to ease the burden on everyday families, others seem more focused on protecting tax cuts for the wealthy and corporations. So, what does this mean for you? U.S. Senator Jeanne Shaheen, D. from New Hampshire, along with Senate Minority Leader Chuck Schumer, D. New York, and several other Democratic senators, including Ron Wyden, D. Orr, Tammy Baldwin, Wisconsin, and Mark Warner, DVA, are sounding the alarm about potential fallout from recent Republican-led actions. These actions include deep cuts to Medicaid and the failure to extend enhanced premium tax credits under the Affordable Care Act, ACA. In response, they've requested a comprehensive analysis from the Georgetown Center on Health Insurance Reforms. Their goal? To better understand how these changes will ripple through the lives of millions of Americans who depend on ACA marketplaces for their health coverage. At the heart of this issue lies a troubling disparity. On one hand, Republicans in Congress have championed nearly $4 trillion in tax cuts, favoring the ultra-wealthy and large corporations. Yet when it comes to extending financial assistance that helps middle-class and working Americans afford health insurance, silence reigns. This lack of action has serious consequences. Without the continuation of enhanced premium tax credits, which currently support almost 20 million people, families across the country may face staggering increases in their monthly payments starting January 1, 2026. It's not hard to see why this situation is causing concern among both policymakers and the public. To complicate matters further, health insurers themselves are already signaling uncertainty. Many have submitted rate filings reflecting double-digit percentage hikes, likely driven by the combination of reduced government support and growing operational challenges within the industry. However, these numbers only tell part of the story. What remains unclear is exactly how these insurer decisions will translate into real-world impacts, such as higher costs or limited plan options, for the 24 million Americans who purchase their insurance through ACA marketplaces. Among them are small business owners striving to stay afloat, older adults nearing retirement age, and families with children relying on affordable coverage. Senator Shaheen and her colleagues aren't just raising questions, they're advocating for solutions. For instance, Shaheen has been a vocal proponent of legislation designed to permanently extend the ACA's enhanced premium tax credits. Earlier this year, she introduced the landmark Healthcare Affordability Act alongside Senator Baldwin and Representative Lauren Underwood, Deal, Illinois. If passed, this bipartisan effort would ensure that millions of Americans continue to benefit from lower healthcare costs. Last week, Shaheen joined her Senate colleagues in delivering remarks highlighting the devastating effects of allowing these critical tax credits to expire at the end of the year. The clock is ticking, she warned, urging swift action before it's too late. This letter to the Georgetown Center also garnered support from additional senators, including Ben Ray Lujan, DNM, Amy Klobuchar, DMN, Adam Schiff, DCA, Ed Markey, DMA, Angus King, IME, Tammy Duckworth, DIL, Jeff Merkley, D.Orr, Gary Peters, DMI, Kirsten Gillibrand, D. New York, Richard Blumenthal, DCT, and Patty Murray, D. Washington. Together, they underscored the urgency of addressing this issue head-on. You can read the full text of their letter here. www.shaheen.senate.gov, IMO Media Doc, Letter to Georgetown, Cheer on Marketplace Final, PDF. As debates over healthcare policy heat up, one thing is clear, the stakes couldn't be higher. Will lawmakers prioritize extending relief to struggling families, or will they allow partisan divides to dictate the terms? And this is the part most people miss. The outcome of this battle won't just affect those directly enrolled in ACA plans. It will reverberate throughout our entire healthcare system. influencing everything from employer-sponsored insurance to state Medicaid programs. What do you think should happen next? Should Congress act to safeguard affordable coverage, or are there alternative approaches worth exploring? Let us know your thoughts in the comments below.